If you're a man over 60, I need you to listen very carefully. There's a silent habit, something done behind closed doors, that millions of men in America believe is secretly destroying their ability to perform in the bedroom. They believe it's a hidden enemy, draining their vitality, making them weaker, and ultimately leading to embarrassing failures when the moment of truth arrives. This belief is so powerful, so deeply ingrained, that it causes men to live in a state of quiet shame and anxiety, convinced they've used up all their vigor. But what if I told you that this belief is a complete and utter myth, and the truth behind what this habit really does to your erections after 60 will shock you? My name is Dr. Claire Foster. I'm a urologist specializing in men's health, and for over 15 years, I've helped thousands of patients reclaim their confidence and vitality. In my practice, I focus on a crucial aspect of men's health that conventional medicine often ignores: the powerful connection between circulation, hormones, and sexual function as we age. And today, we're going to shatter a myth that has held too many good men captive for far too long. Ignoring the truth about your sexual health can have devastating consequences. You might start avoiding intimacy altogether, creating distance between you and your partner. You might feel a growing sense of frustration and a loss of self-confidence that bleeds into every other area of your life. Many men resign themselves to this fate, believing it's just a normal part of aging. But let me be crystal clear, it is not. The belief that masturbation after 60 is the villain that permanently harms your erections is one of the most damaging myths in men's health. It creates a cycle of fear and anxiety that can, ironically, contribute to performance issues. But there is hope, and the solution starts with understanding the truth. As we get ready for the big reveal, tell me in the comments which city you're watching from. I'd love to see how far our health community reaches. Now, let's dive into the heart of the matter. We're going to dismantle this myth piece by piece and reveal the scientific truth. We'll call this the 3 great myths about masturbation and erection after 60. The first myth, and the most dangerous one, is what I call the limited supply myth. The belief is that every man is born with a finite number of erections, and masturbation simply wastes them, leaving you with nothing left for your partner. This is a deeply damaging falsehood. I had a patient, Robert, a 67-year-old retired engineer from Phoenix. He came to my office looking defeated. "Dr. Foster," he said, his voice barely a whisper, "I think I've ruined myself. For years, I believed I was using up my manhood. Now, when my wife wants to be close, my body just won't cooperate. I'm filled with regret." Robert was convinced that his past solo habits were the direct cause of his present difficulties. He was skeptical when I told him the truth, but he was desperate enough to listen. I explained the real science to him, and we put him on a protocol based on this new understanding. 6 weeks later, Robert came back a new man. "It's like a switch has been flipped," he said with a wide grin. "The fear is gone, and everything is working better than it has in a decade. My wife and I feel like we're in our 40s again." Here's the simplified scientific explanation. Your erections are not like a tank of gas that can run empty. Think of it like this. Your circulatory system is a network of highways, and an erection is the result of healthy traffic flow to the penis. The principle at play here is use it or lose it. Regular erections, whether with a partner or solo, act as a form of exercise for the delicate blood vessels and tissues in the penis. This activity helps maintain their elasticity and ability to expand, ensuring healthy blood flow can rush in when needed. By avoiding erections out of fear, you're actually doing the opposite of what's healthy. You're letting the machinery get rusty. The science is clear. Regular sexual activity can help maintain vascular health and erectile function. So, what's the practical application protocol? It's simple. Stop fearing the act. The goal is to encourage healthy blood flow. Aim for regular erectile activity, whatever that looks like for you, in a healthy, balanced way. This isn't about frequency, but about consistency in keeping those vascular pathways open and responsive. It's about retraining your brain to see this as a healthy act of maintenance, not depletion. And if you found that revealing, Wait until you hear about our second myth, as it affects the body in an even quieter, more hormonal way. This brings us to myth number 2, the testosterone drain. This is the belief that every ejaculation, especially through masturbation, significantly lowers your testosterone levels, making you less of a man and weakening your erections over time. This creates a huge amount of anxiety. Let's talk about Charles, a 72-year-old former salesman from Chicago. Charles was worried about his energy levels, his libido, and his weakening erections. He'd read online that masturbation was draining his T levels and had forced himself into abstinence, hoping to recharge. "Doc, I'm doing everything I can," he told me. "I've stopped completely, but I feel worse, not better. I have no drive for anything anymore." He was caught in a classic trap of misinformation. I explained how testosterone actually works in the body and why his strategy was backfiring. We focused on true lifestyle factors that support healthy hormone levels. 3 months later, Charles reported not only improved erections but also better energy and mood. "I feel like I've been released from prison," he confessed. Understanding the truth gave me my life back. What worries you most today? Type 1 in the comments if it's losing erectile function, or 2 if it's declining testosterone levels. Your answer helps me create future content. Now for the science, made simple. The truth is, while ejaculation does cause a temporary fluctuation in various hormones, there is no scientific evidence to suggest that masturbation permanently lowers your overall testosterone levels. Think of it like this. Your body is a sophisticated factory that is constantly producing testosterone. An ejaculation is like shipping out a small package. It doesn't shut down the entire factory. In fact, some studies have shown a slight increase in testosterone after a period of abstinence, but this effect is temporary and not significant enough to impact your overall health or erectile function. Your testosterone levels are primarily governed by age, genetics, diet, sleep, and overall health, not by the act of masturbation. So, what's the protocol here? If you're genuinely concerned about testosterone, focus on the real culprits. Always prioritize 7 to 8 hours of quality sleep. Always manage your stress levels through exercise or meditation. And always maintain a healthy weight, as excess body fat can convert testosterone into estrogen. Stop worrying about ejaculation draining your hormones and start focusing on the foundational pillars of men's health that are scientifically proven to support healthy testosterone production. Now, if you thought those myths were powerful, the third one is perhaps the most insidious because it masquerades as a legitimate health concern. This is myth number 3, the prostate aggravator. The fear here is that masturbation, especially as you get older, irritates the prostate gland, leading to inflammation, enlargement, and a host of urinary and erectile problems. I remember a patient named David, a 65-year-old retired teacher from Miami. He was experiencing frequent urination and a weaker stream, common symptoms of an enlarged prostate. He had convinced himself that his lifelong habit of masturbation was the cause. "I must have inflamed it over the years, right, doctor?" he asked, full of guilt. He was terrified he had caused his own problems and was making them worse. This fear was preventing him from being intimate in any way. I had to reassure him by showing him what the actual research says. Recent studies from leading institutions have turned this idea completely on its head. After we cleared up this misconception and started him on a proper prostate health plan, his anxiety vanished. Not only did his urinary symptoms improve with treatment, but his erectile confidence returned. "To think I blamed myself for all those years," he said. Knowing the truth is liberating. Here's the simplified science. Far from being a cause of prostate problems, a healthy frequency of ejaculation is now believed to be a protective factor. Think of the prostate as a gland that produces fluid. Regular ejaculation helps to flush out this fluid, preventing the buildup of old cells and potentially inflammatory substances. It's like clearing out the pipes to prevent blockages. In fact, a landmark Harvard study that followed thousands of men for nearly 2 decades found that men who ejaculated more frequently, 21 or more times per month, had a significantly lower risk of developing prostate cancer compared to those who ejaculated less often. The science is clear on this. The old belief is not only wrong, but the opposite may be true. The practical application protocol is to let go of this fear. A healthy sexual life, including masturbation, is part of a healthy prostate protocol, not a detriment to it. It complements, not contradicts. Other good habits like a balanced diet rich in lycopene from tomatoes and regular checkups with your urologist. Do not let this outdated myth cause you stress, as stress itself can have negative impacts on your health. So to recap, the 3 silent villains of misinformation are: Number 1. The myth that you have a limited supply of erections. Number 2. The myth that masturbation drains your testosterone. And number 3. The myth that it harms your prostate. In reality, moderate and healthy sexual activity, including masturbation, supports circulatory health, has no negative long-term impact on testosterone, and may even be beneficial for your prostate. Change is possible with consistency and, most importantly, with knowledge. Your body hasn't forgotten how to be healthy. It just needs your command, free from the chains of fear and misinformation. You have the power to reclaim your strength, your confidence, and your vitality. This isn't just about sex. It's about living a full, vibrant life at every age. If this information was valuable to you, please hit the like button so YouTube will show it to more men who need it. And don't forget to leave a comment. I personally read as many as I can. Share this video with a friend or family member who you know will benefit. And of course, subscribe to the channel so you don't miss any of our health guides. And one last thing, a personal request. I recorded this video wearing a mask. It was really important for me to know if the sound quality was good and if you could understand me perfectly. Please leave a quick comment about it. Your feedback is crucial for me to keep improving. A big hug. And I'll see you in the next video.